Hello, hello. Good morning, everyone. Thank you so much for joining us here today. We are just taking a moment or two to get set up, and then we will get started. While we're doing sort of our housekeeping, please feel free to introduce yourself in the chat, share your, if you're a CHW or not, your name, your state, so we can start to get to know each other a little bit. If anyone would prefer to listen to the presentation in Spanish, we do have live Spanish translation available. You can go to your menu at the bottom of the screen and click on interpretation and select Spanish. And I see some folks are starting to introduce themselves in the chat, so thank you for that. Looks like we'll have a good crew here today. So my name is Aurora Grant Wingate, and I work for the National Association for Community Health Workers, or NACHW, or NACHW. I have worked there for 2.5 years as their member and partner engagement manager. And part of my role here is I get to welcome on and sort of introduce new and returning members to who NACHW is, some of the events and things that you can get involved with, and so on and so forth. Before I launch into the presentation, I'm going to hand it over to my new team member, Tasha, to introduce herself.
Good morning, everybody. Well, afternoon, everybody. I'm Tasha. I am the technical assistant associate here with NACHW. I'm a CHW and CHW instructor, so I'm happy to be a part of the team and work with organizations around the nation in regards to training and networking with CHWs. So I look forward to working with everybody.
Thank you, Tasha. So to give folks an idea of the run of show today, I'm going to spend some time going through a standard presentation where I talk a little bit about how NACHW was founded. We're going to do some hopefully interactive activities with the group to find out a little bit about you. I'm going to talk about the Unity Conference and hopefully answer any questions folks have, talk a little bit about some programs and resources we offer. Then we'll go through our website and membership portal. And if folks have any questions after that, we'll take it from there. And thank you folks from putting your names and your states in the chat. We have folks from all over the country, I see, Maryland and North Carolina, New Jersey. So it's great to see everyone. Okay, so first we're going to start with a couple icebreakers. So this is a new program that we have been using to do some poll questions in our events. It's called Mentimeter. So there's a couple different ways you can access it. One way is that my teammate Tasha is going to throw a link in the chat that you can use to answer that poll question. Another thing you can do is if you have a smartphone, you can hold your camera up to the screen and to this QR code over here and get to the prompt question like that. And once you get into that link or web page, you should be able to stay with it throughout. But I probably will ask Tasha to throw in the link a couple times throughout the presentation. Thank you, folks. I see folks are starting to answer. Thank you so much. We'll give that another minute. Okay, I can see folks are still going in and answering. Thank you. It looks like the majority of folks here are community health workers. Here at NACHW, we use the term community health worker as an umbrella term to include the vast diversity within the profession, including promotoras and community health representatives, tribal nations, outreach workers, and the many other job titles we know community health workers hold. Thank you. Okay, so that was our first question. So thank you folks for launching in and giving Mentimeter a try. We have one more question for you folks. If you were going to describe CHWs in one word, or if there's one word that comes to mind when you think of a CHW, or if you think of yourself as a CHW, what would that be? Care coordination, that's a great one. Considerate. Oh, I see someone put in the chat, go-getters. That's great. Oh, I see advocate. And what's great about Mentimeter is it makes sort of a word cloud is one of the options. So you can see if folks put the same word multiple times, that word will become larger. I see folks are also throwing things in the chat. Thank you. Folks are putting things like versatility, an advocate, helpmate, liaison, empathetic. These are all great. I see folks are also putting things into Mentimeter still, which is awesome. I see navigator. I see community, listener. That's a great one. I'll give it just a couple more seconds for anyone else who wants to weigh in. I see a bridge, persistent, navigator. Great words. Okay, so I think this is a really great way to launch into our conversation today. So as some of you might know, NACHW is a very young organization. We're actually only 4 years old. We celebrated our birthday, so to speak, in April. And we sort of came together after years of community health workers and allies wanting to create a unifying central organization to work on issues of professional development and policy and advocacy, and really lift up community health workers across the nation for all those adjectives and words that you folks put on the screen before. And our mission and vision is to see community health workers united nationally to support communities in achieving health, equity, and social justice. And we do this through a few key ways. We want to engage both community health workers and allies, as well as supporters and partners, to educate about community health workers and help them lift community health workers up in their voice. We want to educate stakeholders on the importance of community health workers. And we want to expand, firstly, NACHW's membership, but also recognition for the CHW profession and understanding about how CHWs can help us achieve health equity. And we work to establish a national voice on issues around sustainability and other things related to the workforce. And we really seek to enhance CHW's leadership skills and opportunities to advance in the work. We always want to give credit and give thanks to our incredible board of directors. We have around 20 members of our board right now who are incredibly diverse, both from coming from different places across the country and representing many different communities. We have over half of our board are community health workers, and many others are longtime allies of community health workers. Some come representing promotoras or community health representatives. And I'm sure many of you folks can see that we might have a board member that represents your state or your region, or you might even know some of these folks or recognize these names. I'm also going to spend just a couple minutes talking about membership. So NACHW is first and foremost a membership organization. We now have over 2,700 members across all 50 states and some of the US territories. Around 2,200 of that are individual community health worker members, which is very exciting. And we are getting more members every day this time of the year. And this map just shows the states where we have the most sort of percentage of membership. Number one is Texas, followed by California, and so on and so forth. And now we have another quick Mentimeter question for those who are following along. So I'd love to know, I know you put it in the chat before, but what states are you joining us from? Oh, I see folks throwing it in there. Louisiana, Texas. Excellent.
Rhode Island.
Rhode Island. Thank you, Florence. Texas. Ooh, people are
No,
putting,
this is Kenya.
I'm on, yeah, I'm on as well. They're two from Rhode Island.
excellent. We like to see
No,
that.
three from Rhode Island.
That's fantastic. Ooh, I see folks are still answering. They're throwing it in Mentimeter in the chat. We got folks from all over the country on this call here: Nebraska, Massachusetts, New Mexico, Arkansas, Ohio. So one of the reasons we like to do sort of exercises like this, because we do want to show that we have folks from all over the country, and we want to be a source so you can connect to folks who are working on the same issues and are maybe from similar communities in other places. We want to be a space where you can come together, where you can trade ideas, or even sometimes just lean on one another. And even though we're a young organization, we're working to create more opportunities like that going forward. So thank you, folks, for this. So just to spend a couple minutes on, not sure why that says New Jersey, on our membership benefits. So one of our membership benefits that we'll talk about in a moment is obviously either free or reduced price to our Unity conference, yay. Access to our new membership portal. Every year our board committees recruit new members, and folks have to be members of NACHW to join those. We have a members only newsletter that goes out once a month, which if you're a member, you're automatically subscribed to. We have some members only trainings and webinars we do, such as our quarterly policy calls for folks to come and hear about what's happening across the country in terms of advocacy and policy. And we also, again, want to create networking opportunities for folks to meet other members across the country. And as well as your membership really supports all the things that we get to do and put out for free on our website, such as our policy platform, our COVID-19 resources, our document resource center, and so much more. And without further ado, I do want to give a plug for our upcoming Unity conference. Once again, I want to recognize that the Unity conference is actually something that's been happening for many years, long before NACHW was founded as an organization. The Unity conference is actually what allowed our founding board of directors to come together and dream and create a vision for NACHW, and ultimately build the organization. So basically during the conference, we have both our annual meeting and 2 days of a conference. Our theme this year is the workforce we need for the world we want. Obviously that workforce being community health workers. So on Thursday, August 3rd, we are going to be both in person and virtual. For in person, we'll be in Austin, Texas at the Austin Convention Center. Thursday will be our annual business meeting, where if you are an active member, you'll be able to attend and hear from our committees, hear from our board of directors and our executive director on sort of what's been happening with NACHW in the past year, and also get to elect new board members. Then on Friday and Saturday, August 4th and August 5th, This will be sort of the meat of the conference, and I'll talk a little bit more about what that looks like. So if folks are able to come and join us in person, folks will be able to attend an exciting policy and advocacy training, which is being led by Executive Director Denise Smith, building up to a new CHW Awareness Week. We want to give folks some tools and training to talk to their legislators and really advocate for CHWs in your home states. Beyond that, we'll have 40 other workshops and trainings, which range in topics around self-care and yoga to how to prepare to be a researcher as a CHW, or maybe improve your supervisory skills. So a whole range of different topics. We'll have over 100 different booths available at the conference, some from national organizations, our sponsors. We're also working on getting some local vendors to come. We're going to be feeding folks who come. We're also going to have a gala sort of on Friday night where folks are going to come. We're going to be doing some CHW awards, as well as, have some time together to network and to dance and to sort of celebrate getting to be together. But if folks are instead going to attend virtually, which we also highly recommend, you'll also be able to watch our annual meeting. And if you're a member, elect new board members. We will be live streaming some keynote speeches. And we're also going to be having some of those workshops and trainings virtually. That advocacy session that I mentioned that Denise will be leading is also, again, going to be offered virtually. We're working on creating some virtual engagement opportunities and some networking opportunities so folks can still get to connect with folks all over the country virtually. So registration is now live. We know folks have been waiting for it. So if you are a CHW member, registering for the virtual conference is free. You can go and log into our portal and register. If you want to come and join us in person, that's $75. And the other prices you can see on screen or at NACHWunity.org. Registration is up and going, so whenever folks want to register, that is available. See, folks are also putting things in the chat. Yes, Sarah, I see that you asked, how do we sign up for the conference virtually? I'm going to take you through how to sign into your membership portal, and I'll show you exactly where you can find the link to register virtually to make sure folks know. That's how to get there. I also see Sarah ask, what is the difference between an ally and a CHW individual? For NACHW membership, we have two types of individual memberships. One is for folks who identify as community health workers. Again, and that is how you self-identify. And the other is if you self-identify as an ally. So that might be folks who work with CHWs or partner with CHWs on research. I consider myself an ally because I get to work and help put together things for NACHW. So hopefully that helps clarify things a little bit. We are also right now recruiting volunteers for the Unity Conference. You can also find that information and sign up at our NACHWunity.org. We also want to give a plug for those who are joining us in person. We have partnered with 2 hotels that are right next to the convention center that folks can register with to get a reduced rate. You can once again find that information at NACHWunity.org under event information. And right there, you'll find the links to sign up for those hotel rooms. And also, I'll let folks know that all these links and information, I'm also going to be emailing it out to everyone who registered for this webinar. So you'll get the slides, and I'll make sure to call out some of these important links. Do folks have any questions on the Unity on the Unity Conference. I see someone put a question in the chat. Can an allied member be a CHW? Is there a fee for allies? That's a great question. It's really just how you identify. If you identify as a CHW, then you can become a CHW member or just sign up for the CHW price. If you feel like you more identify as an ally, then you can either become an ally member or just register at the ally price. So it's just how you identify. And then I also see that we got a question in the chat about the newsletter. If folks aren't receiving the newsletter or are wondering if they're signed up, please reach out to info@nachwa.org, and they can double check and make sure that you are all set with that information. Then I see Kimberly also asked, what are some examples of volunteer roles? For folks who are able to come and volunteer, we may ask folks to help folks when they're coming in to get registered, to make sure they have their, their map and their badge. We might have some folks in our exhibitor hall helping to direct folks. Some folks who might be in a workshop or training to make sure things go smoothly and get folks checked in, answer any questions. For folks who are able to volunteer, we're also going to waive the registration price. So those are just a couple examples. But again, if you put your name on down at that list, it's non-binding. We're just going to be sending you some updated information in a week or two around those roles and the exact hours and all that good information. Oh, and I see someone ask for a reminder. If you want to join us in person for the Unity Conference, it will be in Austin, Texas, August 3rd through 5th. Okay, there'll be more opportunities to ask questions if things come up as we go along. But for now, I'm gonna move on. Well, first, we actually have a quick Mentimeter question. We'd love to know, I know folks might need some more information, but do folks know if they're gonna be joining the Unity Conference? I see Esmeralda ask, is going on the 3rd, which is for our annual meeting, mandatory for members? No, it is not mandatory at all. Folks are welcome to join and hear those updates. We'll also have some sort of summary materials available. So if folks are able to, or if they would like to, you're welcome to join on the 3rd as a member, but not mandatory at all. And I see some folks are putting in the chat, some folks are undecided, some folks are joining virtually, which we love to see. And we even have some folks who here who are going to be joining in person. I see Kimberly also asked, can the annual meeting be attended virtually while traveling, and the Unity days 1 and 2 attended in person? And I would say yes. I don't see any reason why not. You should still be getting the link to join the annual meeting. And then if you wanted to sort of do either or, that should work out fine. So yes, definitely an option. But this is great. I'm so excited that we're going to get to see some of you in person or some of you virtually. And for those who are undecided, feel free to reach out if you need more information. We're here to hopefully answer your questions and make it as accessible as possible. Okay. Now I'm just going to spend a couple minutes talking about some of NACHW's programs and initiatives. Let's see. So first, I want to give a plug for the CHW Document Resource Center, or the DRC. This is the NACHW's largest database for community health worker research and policy documents. This is something that NACHW is really proud to get to house and continue to work on. This is something free and available to use on our website. Here is a great place if you're interested in learning about a state Medicaid policy. There's lots of documents on CHW networks and workforce studies. There are studies on effectiveness of CHWs in different fields. So it's a really great place to start and dig around what might be happening in your state, or if you want to get involved in policy on a deeper level. I also want to give a plug to NACHW's policy platform. The NACHW policy platform came out at the beginning of the COVID-19 pandemic. What NACHW sort of witnessed during the pandemic was that because of the lack of trust generally in the public health system, folks realized that they needed community health workers. They needed people who knew the community and had those trusted relationships to educate folks on things like social distancing and vaccines. So there was a real newfound interest in community health workers. But despite that newfound interest, lots of people were not giving community health workers how they should be treated the way they deserve to be treated. We got reports that community health workers were underpaid, that they weren't being respected in their fields. So through 30 different CHW associations, 3 different national polls, many partner meetings, and member feedback, we came up with the policy platform. The real key message of the policy platform is that we want to encourage people to respect, protect, and partner with community health workers around COVID-19 and beyond. And we hope that this language that community health workers can take it back to their home states, to their employers, and use it to have conversations, to advocate for the profession, to get better wages and better pay, and so on and so forth. We are now working on updating the policy platform to make it a little bit more evergreen, so you can be on the lookout for that going forward. And we have the policy platform available in English and Spanish. Beyond that, in our world for policy and advocacy, we have phenomenal quarterly policy calls that are led by our policy committee, where they give updates on what's happening nationally and in different states in terms of policy with Medicaid reimbursement, with CHW networks, with CHWs getting recognition. We also have a policy review request form, which you can find on our website's policy page. If folks have a policy they want the policy committee to review, you can submit it. And they will give their feedback. And then also on our policy page, we have some curated resources and reports on things like sustainable financing and statewide training approaches, and so on and so forth that folks can view on our website. And I see someone wrote in the chat, Sarah said, is there a contact for the policy committee? I would reach out to our staff member, Angie Kuzma, who is our policy and advocacy manager, and I will message you her email, or you can find it on the website. No problem. Okay. I also want to give a quick plug to the partnership we had with the American Diabetes Association on their Focus on Diabetes initiative. Through this partnership, NACHW was able to work with the ADA to develop training in English and Spanish, along with many resources on diabetes and diabetes-related eye disease. All of these resources, as well as the trainings, are available on our website for folks to use. We hope that these stay relevant and useful for folks going forward. I also want to give a huge shout out to our CHW national data in 2021, thanks to a partnership with Johnson & Johnson's Our Race to Health Equity. NACHW was able to launch a CHW-led national survey. This was led by a group of phenomenal CHW leaders who really wanted to focus on, what do CHWs want to learn about the profession? What is it like to be a CHW? So through that, they got over 150 responses from CHWs in all 50 states, representing many different titles and regions and sectors and ethnicities. You can find this 4-part webinar series on our YouTube and also on our website, where they dig into this data and sort of really break down how they got the results and how they went about creating the survey. You can also find those infographics on our website that, again, just sort of break down what we learned. And in the next couple of months, we can look out for the full report that the CHW leaders wrote about our findings, our takeaways, and what we want to do next in terms of getting good national data on the profession. And I see, Kimberly did a shout out about the summit series. Thank you so much, Kimberly. Okay, I want to do another quick plug to COVID-19. We know that even though the public health emergency has ended, we want to give our thanks and appreciation to the folks all over the country who continue to educate around COVID and be first responders. And we want to recognize that the sacrifice folks have made in the last few years. NACHW has really grown up during the COVID-19 pandemic, and through that and through requests from our members and partners have responded in a variety of ways. We do have a COVID-19 webpage with resources for CHWs. In several instances, we've worked to gather CHW data on the experiences of CHWs responding to COVID. And we've done a lot of advocating for national policies, again, for better treatment for community health workers and for health equity more broadly. And through what we've learned from our members, we've also worked to have more self-care resources and webinars and mental health resources, both for community health workers and for the communities they were serving. And going forward, we really want to lift up the role of CHWs for being really critical in pandemic readiness. These is just sort of a variety of different partners that we work with throughout the pandemic, and some of the different work we did in terms of writing blogs and holding webinars, and hopefully creating some infrastructure to better address sort of resource needs in the future. I also want to give a quick report out that in the beginning of 2022, NACHW was able to work with the White House to test covidtest.gov. This was something folks might be familiar with or might remember. This was initially that all folks could order 8 at-home tests to their home. Then it went up to 16, then it was sort of unlimited. But before they launched covidtest.gov, thanks to our executive director's advocacy, they agreed to work with us for 2 goals. Firstly, to test the site to make sure that it worked and it was sort of easy to use. And the other was to sort of prioritize community health workers and vulnerable communities to make sure they were receiving their tests sort of first before the general public. Through that partnership, we were able to bring folks through our page and have over 500,000 orders to covidtest.gov. And we were also able to provide education on how to use at-home rapid tests. We translated all these materials into 5 different languages. We held some town halls. And we also got to work with a lot of amazing partners who also work to rally and mobilize their networks and other community health workers and their networks to help meet that moment of COVID-19. One of the things that we're doing right now, we're getting asked a lot of questions about pandemic readiness. And sort of what does that look like? And how can we best equip community health workers to respond to future pandemics? So we always want to be, asking our members, what do you think is best for future pandemics? So the question I'm sort of asking you folks today, if you were the president or if you were another person sort of in power, what would you want to do during the next pandemic, or what would you want to have in place before the pandemic to help your communities and to help have better equity? And thank you, Tasha, for putting that in the chat. Or the answer is not going to pop up. Oh, folks, I was hoping the answers would pop up, but I also want to invite folks if they want to come off mute and share for a minute or two, or if they want to throw things in the chat and share, what do you think we could be doing better for future pandemics? Kimberly put in the chat, have full disclosure of all side effects for medicines and injections. I think that's really important for building up trust. Okay, well, someone else said invest in preventative measures. I think that's huge. Provide all relevant information and true scientific facts. Absolutely. We want to make sure that communities have all the information they need. I know when I was talking, I had another presentation yesterday with some community health workers, and what they were talking about is, make sure folks already know about community health workers and know those referral networks sort of before it happens. Make sure you have that sort of infrastructure and those systems in place before you really need them. And thank you folks for participating in that. Here are they. Okay, here are the responses. Yes, I see invest in preventative measures, access to mental health resources. That's huge. Mobilize a team that knows the different areas. Better access to medical care. Absolutely. Prioritize public health over politics. Stick with the science. Putting out timely information, work for better internet connectivity. I think that's huge. As we saw with covidtest.gov and all the different sort of telemedicine, that can be really important in times of a pandemic. So thank you, folks. I think this is right on. And lastly, we just want to make sure folks know sort of how to get in touch with us and where we're giving out updates. So as we said before, definitely our newsletter, and folks should already be signed up. But if folks are having any issues, please contact info@NACHW.org. You can also follow us on Facebook, Instagram, Twitter, and LinkedIn if you get updates through that. And of course, our website at NACHW.org to get more updates. Okay, I'm going to take a pause and see if folks have questions about any of that before I go into sharing a little bit about how to access our website and membership portal. Okay, that case, I will. Okay, someone put something in the chat. Oh, I see someone. Can we as NACHW members create a local CHW network of associations to help grow NACHW's numbers? That is a great question. Do you mean sort of bringing together CHW networks that already exist? I'd love to hear more about that if you wouldn't mind unmuting.
Yeah, because I am currently still in school completing my CHW certificate, we have to do a capstone.
Mhm.
So my idea for my capstone was for my local community of ladies that's in my class, create like a local network of community health workers that have different things that they, will do and provide toward the community. And then as the classes come through UNMC, people who graduate and want to join our memberships, our numbers, and we can just build in Omaha, Nebraska, and do something like that. That's kind of the capstone I was thinking about completing for school.
Yeah, that sounds incredible. I'd love to, if you don't mind, if you want to set up a call and talk a little bit more about that, I can put my email in the chat. I think that's a great idea.
Sure.
Love to
Great.
support you in that.
Good
And
deal. Because I just, when I found out about the National Association for it, I was like, well, and it doesn't make any sense to not be a part of that if I am a CHW. And in order to grow membership numbers, why not kind of make that my capstone? So since I'm in school and I have to have a
Yeah.
project, I'm going to go ahead and make this it. So I will definitely reach out, and thank you for responding.
Yeah, of course. Thank you. Okay.
Thank.
Want to show folks our website in our last few minutes together, just show folks around. So here is NACHW.org. Our website is sort of organized in a couple different places. We have About, which sort of goes into similar to the presentation I gave today about our committees and about our history. Here, if you wanted to learn more about that CHW data and the CHW leaders, and then a little bit more about our committees, we have sort of our resource hub, which has some general resources, our COVID-19 page, our mental health resources, our focus on diabetes pages. And we're also working right now to add many other pages on hunger and nutrition, and racial justice and equity. So be on the lookout for those. We have a policies page with all those different resources, as well as our 6 Pillars campaign. I didn't talk a lot about this today, but this is a new campaign and hopefully some language folks can use to advocate and explain sort of the community health worker role. Here we have a webinar we did, as well as some language and social media graphics that folks are welcome to use and share with their network. Here is also where you can access the Document Resource Center if you're interested, again, in looking in those data or research database. Here is our membership page if you ever want to hear about our membership, or if someone else wants to become a member. Here we also have a list of CHW networks. We always want to encourage folks to reach out and see what folks are also doing at the local level. There are CHW networks in so many states, and there are many others who are growing their networks. So we really encourage folks to also be members of those networks. We also have events. If you ever want to come and check out what webinars we got going on, we usually have around 2 webinars a month. And then we also have a partnership page if you ever want to connect with us or meet with us. Let's see, I see some questions coming in the chat, so I'll take a pause. I see Natalie said some states have CHW organizations. Many states do have CHW networks at the state level. What I'll say is, if you don't have one, we also want to encourage folks to start one. And we're also happy to sort of give a meeting and talk or connect you to CHWs who have started CHW networks in their state. Many of our board members did that. They looked around and they said, you know what, we want our own CHW network. So happy to connect you to them and see if maybe you're the one to start that organization. I see Kimberly put Virginia has a CHW association, definitely. Yes, I see folks are talking about the CHW networks, definitely. Shantae, I see you put, do you have any forms that we can use as well? Can you explain a little bit more what you mean by that?
Yes, I'm talking about forms like open-ended questions, like forms for people who are new.
Sorry, you were very quiet, but do you mean forms for new members? Is that correct?
No, like if you have, for your first time, like if a person has a client in front of them and they need to use a form, to look at, like open-ended questions, for instance. Can you hear me? I'm at work, so I can't talk too loud.
No, you're good. Yes. We don't have a lot of resources like that. Some places you can look out for those resources are your local CHW network. I'd also recommend looking at the Common Indicators Project, which you can look under our policy page. There's a link to them. They do a lot of work in evaluation and some of those key sort of tools. And then I see Latanya has asked, where is the link to update member information, which is a great link to where we're going next. Okay, so if you're interested in accessing our membership portal, you can go to our homepage at NACHW.org, and then right here we have a green button that says access our member portal. And from there, a new screen will pop up, which is NACHW.memberclicks.net. From here, you'll see an introduction from NACHW. You'll see some events on the right-hand side. And you'll learn a little bit about becoming a member. If you're already a member, you can go up here to the top right and click member login. From there, you can put in your username and password. If folks ever forget their username or password, we do have reset links right here. And if those are still ever giving you trouble, feel free to reach out to info@nachwa.org. And there I'm going to log in. And then it pops up to my member portal. And if folks want to go in and fill out their membership profile, you'll want to go right here to my profile. And from there, it will show you all your different details. You can go through and and fill out your profile. It'll ask questions about what field you work in, how you identify. You can update your membership if you need to do that, if it's renewal time, and so on and so forth. Okay, any questions about the membership portal? And with that, if folks are members and they want to register for the conference, you'll want to log into your portal. And then right here on the right, you'll see Unity registration. And then you will be directed to this page on the NACHWUnity.org site to get a member ticket. And here you can either join in person or virtually. I'm just pausing to make sure I'm not missing too much in the chat. And I've also gotten some questions about slides. I'm going to be emailing everyone out these slides to make sure everyone has those links. And I see Florence asked, how much is membership for CHWs? Membership is $20 a year. For allies, it's $50 a year. And I also see Wanda asks, are there any plans to have title of CHW copyrighted so that people who are not certified CHWs can use that title? I think that's a good question. I don't know if I'm qualified to answer it. I think different states have different policies around certification of community health workers. Right now, what we can say is there aren't any national CHW certification program, so it varies from state to state. What we like to lift up is the CHW Core Consensus Project to make sure that CHWs are being able to receive training in those core areas that have been sort of endorsed by the profession. Let's see, any other questions? I'll stop sharing my screen for a moment. Anything I've missed throughout the presentation in the chat? Okay. In that case, that was all the information I had for folks today. Thank you all for coming and participating. We're still getting used to Mentimeter. I'm excited to see many of you at the Unity Conference, either in person or virtually. Thank you so much for being our members. Our members are the reason that we can do this and create so many free resources for the profession. And we're really excited for what we have coming up this year in terms of advocacy training, in terms of creating virtual networking opportunities for policy calls, and so much more. When you exit the Zoom, you're going to get a brief survey so you can let us know how this webinar was for you. If you have ideas on how we can improve, if you will have ideas on different webinars you'd like to see in the future, we'd love to hear your feedback. Thank you, folks. Appreciate it. Have a great rest of your day.